I want to thank you once again to tuning in to the American Community Chaplain Corps training. I am Dr. K. Llewellyn McGee, the founder and world director of the American Community Chaplain Corps. In this particular course, this video that we have here, we're going to deal with interventive spiritual care. Again, interventive spiritual care. What is interventive spiritual care? It is care after a critical life event up to 30 days. And the way in which you provide care after a critical life event, that critical life event could be positive or it could be negative. Positive one would be getting married. A negative one would be immediately after a death of a loved one. But when you finish this particular training, you can rest assured that you are ready to provide interventive spiritual care to anyone. Really, we talk about 3 courses in this particular phase of training. The first course is Pneumatology 201, Interventions in Spiritual Care. And we talk about all the different interventions and how you provide intervention to anyone, positive or negative, of a life event that may happen. And when you finish this particular training course, one of the assignments to complete that is to write a 3-page reflection paper on interventive spiritual care. And that may include things like all of the concepts that you must be able to digest, learn and digest, I must add, in providing intervention spiritual care. It may include what are some of the interventions you may do, how you develop a spiritual care plan after a critical life event. Remember that the training is immediately after a critical life event, up to about 30 days or so. So the first course, understanding, is Pneumatology 201, Interventions in Spiritual Care in this particular phase, which is the second phase. The second course that you will need to learn is ethics. Ethics, and really morality and ethics, where we show you the difference between what morality is, and we define morality as the knowledge of what is right and wrong, and ethics as the practice of what is right or wrong. Okay? So we talk about that. And in this particular course, we help you understand morality, different types of morality, different types of ethics. We go into what we call the ethical decision-making process, where you facilitate with your clients and patients and members how they are to make a decision. You're not making the decision for them, but you're helping them make a decision that really is the best choice for them and those around them. And sometimes that is a very slight nuance, but we're really helping them make the best decision. So we tell you what this process is, and we hope for you to learn that. And so the assignment is for you to come up with your own case study of an event, someone dying, even within your family, and you are to write a 3-page reflection paper on the intervention or counsel of what you did to help them make a decision, and why you advise those particular options with them. And if you may say, well, I haven't had any, but think about a case, and if you don't have one, can't find one, then come up with the case and what you would say to a person, and you give the scenario or the situation of what has happened, and you give us what the intervention was, and how you help them come and make a decision. Not to make a decision, but help them make a decision. Okay? And then lastly, the last course in this particular phase, this is the second phase, Interventive Spiritual Care, is speaking and worship in a pluralistic society or a pluralistic environment. What do we mean when we say pluralistic environment? As chaplains, we operate like healthcare chaplains, whether in the military or in the hospital. And if you did not know, military chaplains, which I'm one, I've been in the military chaplain corps since 1993. But we, as military chaplains, take care of everyone who may be in our particular command or unit, but we also take care of those who may be of our particular faith group or religion. And so we walk a fine line of care. And I came up some years ago when I first came into the chaplaincy that I asked the question, how do I take care of all the people that I'm responsible for in a consistent manner, so would not be prejudiced to providing care? And what was shown to me is that what are the commonalities and what I call universal commonalities of all people, that they have bodies, they have minds, and they have spirits. And when you get that understanding of spirit, then I can take care of their spirit. And so that's the work that is universal to all people. And then I can do the religious side to those who are of my particular faith group. And one thing to note is this term, spirit or pneuma, is found in almost every religion and culture in the world. If you're talking about the term spirit in Hindu, it's prana. If you're talking about the term spirit in Jewish Hebrew, the term is ruach. If you're talking about it in Greek, the term is pneuma. If you're talking about it in the Latin language, it's spiritus. You talk about it in the Chinese culture, it's chi or ki, some pronounce it, but all mean the same thing. It is the spirit of a person, it's the life energy, it is the life force in all living things to include human beings. And so that's what I call the universal commonality of all people. And so we know we have medical doctors taking care of our medical or physiological needs, and their treatment plan deals with providing medicine to people to help cure them. You have mental health specialists who deal with mental disorders of the mind, but it gets very, very fuzzy when you talk about the spirit of a person. And so I have developed a very unique, copyrightable methodology to providing care to the spirit. I haven't seen it anywhere. I have a master's and a doctorate dealing with pastoral care and counseling, health and welfare. And so this course is unique and will help you really do that with the 3 courses that I have given to you. And so you really, really will be prepared to take care of anyone. Again, the 3 courses are Pneumatology 2, or 1, Ethics, and lastly, Speaking and Worship in a Pluralistic Society. So think about those courses, and again, your assignment will be write a 7-minute sermonette on a topic of your choosing, that you understand that you are in a community chaplain speaking in a pluralistic environment. Okay, you are speaking in a pluralistic environment. Okay, so that means multiple religions will be there. Again, if you have any questions, just go to www.thespiritcenter.org. Go to the School of Chaplaincy tab. Go to the Register Online tab, and fill out your information and just ask your question, and someone will get back with you very shortly. Again, my name is Dr. K. Llewellyn McGee. I am the founder and world director of the American Community Chaplain Corps. Know that we're trying to care for people because we want them to know